There are some unusual reporting requirements for PT assay results. Let's talk reference ranges first. Typically, for a normal patient population, it takes about 11 to 12.5 seconds for their specimen to clot in the PT assay. With warfarin therapy, remember we're trying to prolong that PT because those patients are prone to hypercoagulability, and so we're looking to elongate or prolong that PT by a factor of 1.5 to 2-fold. We don't report the PT in terms of seconds, however. We report it in terms of the PT-INR. The PT-INR takes into account variations between manufacturers in thromboplastin lots and protocols. So this internal standardization, the ISI, has been developed so that you can normalize your data, whether it's generated in one country or another, in one clinical lab or another, and allow those results to be compared for patients with the standardization so that if and when there is a variation in their PT, it is a meaningful result. So that INR is achieved by dividing the PT of your patient by the mean PT of your normal patient pool and taking that product and raising it to the ISI value. That ISI value can be found in your manufacturer product information from your recomboplastin materials. But it's absolutely critical that you get that right. Patients have been unfortunately lost because this calculation wasn't performed correctly. And it's important to know that there is a critical value for your INR, and if you achieve a level of 4.99 or greater, you are at risk of bleeding and your medical care needs to be addressed. The PT is a great test for, of course, the extrinsic and common pathway in general, components of that. It's also a great test for liver function because so many of the factors are produced in the liver, and the half-life, for example, of factor 7 in particular is very short and affected by that liver function. And so a great assay for testing liver function and determining if your patient is at risk potentially for bleeding or coagulation, and if so, what factors may or may not be involved. As far as references go for this talk, I use LabCorp and Geisico Medical Laboratories for a lot of the specimen handling information, and Diagnostica, the company, for information on the analyzer and hemostasis protocols and some of the elements of valid reporting, and of course the HemoSeal manufacturer inserts for considerations on how to make reagents and find that ISI value.